This is the Fix Your Sciatica podcast. So here we are, 101 episodes, and I thought it would be a great opportunity for us to talk about the concept of regenerative medicine. And one of the most common terminologies or interventions that people hear or think about when they hear the word regenerative medicine is this concept of PRP. What is it? How does it work? Will it work for my pain? And so today I have a very special guest who knows all about regenerative medicine from his profile when I first met him, traditional Chinese medicine, acupuncture, PRP, the works. And he was kind enough to be a guest on today's episode. So today I have Dr. Fields coming all the way from Florida. Dr. Fields, thank you so much for being on today's episode.
I appreciate it, Doc. Thank you for having me. I'm very excited.
The excitement is mutual. So let's talk about you. For the listeners who might not have met you before, tell us a little bit more about yourself, your journey, and where you're at today.
Yeah, absolutely. I'm happy to speak about that. You know, I started getting into holistic medicine through my love of martial arts. Been in martial arts most of my life, taught professionally for over 15 years, including professional fighters, UFC guys, amateur fighters, boxers, all that kind of stuff. And we've done, independent movies, like low budget action movies, like all that fun stuff. And about 10 years into my practice, 10 years into the martial arts practice and teaching, in my early 30s, I got really, really sick. I mean, I was having probably a dozen different symptoms: hot flashes, chills, fatigue, depression, severe joint pain systemically, every single joint in the body, severe carpal tunnel, tendonitis, severe neck and back pain. I was physically disabled. I couldn't work for almost a year. And I had already been studying the Eastern medicine from the gentleman who got me into acupuncture, my Qigong master, Dr. George Love, kind of introduced me to it. And I had been studying with him for about 10 years prior. But I just reached a point where I guess what I was doing was no longer working for me. And I spent a whole year, hopping from doctor to doctor to doctor. Saw a few different orthopedics, 3 different neurologists, endocrinologists, had biopsies on my thyroid, all that fun stuff. I had 2 doctors that wanted to do carpal tunnel release surgery on me, never did it, never went through with it. And for the most part, all these doctors were telling me, oh, it's all in your head. Here's pain pills, here's muscle relaxers, right? Do carpal tunnel surgery. And I just didn't like any of those options. I think I tried one muscle relaxer and I just knew better. I had seen enough of my friends go through it and, family and all that. And I just said, okay, but even if it worked, well, what about next week? And how does that help all my other problems, right? It doesn't help any of my problems. So I had already been studying and apprenticing with my acupuncturist for 10 years prior and helping him with his seminars and helping him teach his seminars. But after going through this myself and not getting any help from conventional medicine, eventually I walked into a nutrition shop, Nutrition Direct, owned by one of my mentors, Reed Eckert, who's a formulary. He actually invents vitamins. And as soon as I walk through the door, he just tells me, you look like crap. And I tell him the whole story. And he tells me, I know what's wrong with you. I'm going to get you fixed. I don't believe him because I'm like, I've seen all these doctors. Like, dude, you sell vitamins. Like, what are you going to do for me? Right? Nothing. And, he put me on some stuff, and within a few weeks, it was like a miracle. The hot flashes, the chills, the depression, the fatigue was like instantly lifted. He put me with a good chiropractor by the name of Paul Grillo. They had me make some lifestyle changes, some dietary changes. And I was pretty healthy by all means. I had tried to go vegan a couple of times. That probably was part of the problem. But I wasn't eating junk food. I wasn't eating too much sugary stuff. I was pretty healthy overall. And overall, I just started getting better and better and better. And within about 6 to 8 months, I made a full recovery. And having lived through that and being super frustrated with the healthcare system and not being able to get even any help, even though I had insurance and I was young and healthy and active, and all these doctors couldn't help me, it really, I knew I had to make a change of lifestyle, and I knew I didn't want to go back to doing the same thing that kind of got me there. And it added like a purpose to my life. I knew I wanted to help other people in similar boat to me, kind of, be able to also recover, make a full recovery without all the drugs and unnecessary surgeries and things. Those things all have a time and a place. Obviously, if there's an emergency, please get the jaws of life. I want to be airlifted, whatever we need. But for chronic conditions, and this because you're in the field, medications and surgeries are often overprescribed and unnecessary. That led me to go back, and then I went back and did my bachelor's in health sciences and my master's and my doctorate in both acupuncture and Eastern medicine. I've done about a ton of functional medicine certifications, and I've done some training in regenerative medicine, stem cell therapies, advanced stem cell therapies, IV therapies, vitamin and trigger point injections, all that kind of stuff. We have a pretty broad scope of practice in Florida, which allows us to do a little more than some of the other states.
And I think that's fantastic. Going through your journey, I'm thinking, man, you're probably, that's a couple of years of living with, all of these issues. And I think it's important for people to listen, like listeners, to know that most of the time when you're working with, say, a professional, most of the time, if they don't know what's going on, they're kind of just like, I don't know, I'm just, just going to give this to you. And they don't necessarily say, hey, try X, Y, and Z. And oftentimes, and you probably said this for yourself, Dr. Fields, but I know for myself, it's like, if I'm looking for an answer and the person who I'm working with isn't able to give me the answer or direct me, I'm actually doing the research on my own. I'm actually advocating for myself, which I think it's important throughout your entire journey to advocate for yourself. If you're not getting the results that you want, need, bring it up with your provider and just continue to never stop searching, because there are so many different modalities that are out there that are designed to actually help out.
I love that message. I'm glad you brought it up early on in the conversation, because what happens is a lot of people do give up, right? They'll see one or two providers that they don't like or it didn't work, and then they just assume all physical therapists are the same or all acupuncturists are the same, and they're not, right? There's so many different styles of practice. There's so many different modalities. There's so many different types of training, and a lot of it will depend on the competency and also compliance from the patient, right? If you don't vibe, or if you don't gel, or if you feel a provider is being disrespectful to you, the compliance is likely to be very low. The patients aren't going to follow the instructions that they were provided. So yeah, I agree. Always keep searching. If you haven't found it yet, don't give up.
And to piggyback off of another big thing, when you were going through, you were saying you were having these hot flashes, you had all these other symptoms in addition to your carpal tunnel pain, right? And I think that is a good highlighter for you listeners, that whenever I work with people and whatever provider you are working with, one of the things that they should be looking for is what we call medical red flags. And so when I'm working with someone who has sciatica pain, or even any issue when it comes to pain management, if their pain is accompanied with fevers, feeling unwell, all these other symptoms that aren't necessarily related to the specific joint, that is something that should be looked at. That is not the pain that you're experiencing may not just be an orthopedic problem. It might be a systemic issue, just like Dr. Fields was saying, was that being able to have these changes to his life, which actually made him feel a lot better. So that was another thing I wanted to bring up.
Yeah, and that's a great point. And what we do is very similar to what you do, in the fact that it's a root cause based medicine, right? So even if you're diagnosing somebody for whatever, right, if they're just, like we spoke a little bit earlier, if there's a dysfunction in how you're walking, or your back pain, or if you have sciatic pain, is that a muscular dysfunction? And is what else is contributing to that muscular dysfunction besides posture, besides previous injuries, besides whatever you're doing to it, right? If you're dehydrated or a lack of nutrients, or whatever it can be, there's a million different things, or there's some kind of underlying inflammatory process that's driving that. And then whether it be myself or yourself, and I often work, with guys like you, and I refer out to PT very often. And once again, having somebody that's good and knows what they're doing is the key there. But if if you have one of these systemic problems, it doesn't matter how many times we treat you, you're unlikely to have lasting improvement. And then it becomes this model where you need treatment forever and you're not actually getting better, which I think is disingenuous and not the kind of results I want for my patients to have. I want them to have lasting results, because that's how I get referrals. I don't need to lock you into some kind of plan to see me forever. It's the exact opposite of what I want, and that's not how I would want to be treated as a patient.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts. Yeah, and there's two industries in which when you get the job done, it kind of takes business away from you. And number one, it's actually the dating industry, because once someone finishes dating, they're married, like they're not a customer anymore. But then the second part is healthcare. It's like the moment that a patient is fixed or healed, they're out of the medical ecosystem, which actually makes it challenging for the business. But you're absolutely right. Like being able to get people better faster, one, that's the most genuine way versus trying to keep people on just so that you can, keep them paying you. So I really appreciate that. So let's talk about this regenerative medicine, right? Mm-hmm. Specifically the modality of PRP. It has, from what I've observed, definitely has gotten a lot more press, we'll say, over the past 4 to 5 years, especially when people want to move away from the steroids and epidurals and all the stuff like that. So can you tell us a little bit more about PRP, what it is, and just a little bit of the science behind it?
Yeah, so the platelet-rich plasma technology has been in use for probably at least 20 years. I know the orthopedic that trained me on it does all the professional sports teams out here, and he actually gave up after 30 plus years of doing surgery to just go into regenerative medicine alone, because he was seeing the results and didn't want to feel like he was butchering every patient. And on the other side of it, we've seen in the last few years papers and clinical studies coming out on the cortisone shots, right? That sometimes will actually degenerate the joints even faster. While they may give you some temporary anti-inflammatory relief, you may need a total joint replacement faster. I think the papers were specifically for hips and knees, but common sense would say that probably applies to the rest of the body as well. In addition to that, a lot of the side effects I see sometimes with too many cortisone shots, I'll have patients, if they have blood sugar issues, where they start getting, unexplained weight gain, right? Because if it's a steroid, essentially. So sometimes it'll blow people up. Sometimes people have other bad reactions to them. So you are correct in the fact that people are looking for more alternative, safer things. So platelet-rich plasma, it's a very simple process, actually, and it works much like acupuncture or bloodletting or some of these other technologies and treatment methods that have been around forever, right? What it is that there's no drugs involved. There's a tiny little bit of blood thinner that goes in there just so the blood doesn't clot. But for the most part, what you're doing is we're drawing blood. So when I do it in the office, we have a phlebotomist come in and they draw your blood. They take 40 cc's, 50 cc's, depends on how much we're doing. It's not much. You're not taking much out. You'd want to hydrate before you come in, obviously. And typically, the healthier you are, the better your cells are going to be to repair themselves, okay? But they draw the blood, and then it goes into a centrifuge, and the centrifuge spins them very fast. And there's different ways to do it. There's some systems that do 1 spin, some systems that do 2 spins. But for the most part, what we're looking to do is to concentrate the platelets. The platelets is what has the most healing ability, right? They have the most amount of cytokines and growth factors. So these are basically growth factors and steroids and natural anti-inflammatory compounds that are found in your own blood without adding the drugs. So we put it in the centrifuge, it spins around, it separates the plasma from the red blood cells with the platelets in the middle. And some doctors use only the plasma and the platelets. The way I was trained was to use a little bit of the red blood cells too. It does cause a little more inflammation on the front side. It's not really that noticeable. I've never had a patient complain about it. However, there are certain cytokines and growth factors and things that are only found in the red blood cells. So if you throw that away completely, sometimes you're throwing out the baby with the bathwater. So the way I was trained is to use a little bit of that as well. So we take the concentrated, and the ideal concentration is about 5 to 7 times. So the idea is we're taking your blood that should be healing itself anyway, right? That's how the body's designed, right? If we get a cut, you bleed, it scabs, it heals, right? So it's exactly the same process, and acupuncture works the same way. We're just expanding, we're just concentrating 5 to 7 times more. We're getting the platelets. I have a special system in my office where we actually expose the blood afterwards to a photonic light chamber. So it's a light type of therapy, which kind of activates the stem cells and the PRP even more. Most places don't use it. It's just more added benefit for the patient, right? And then you would find the location that was injured. Let's say if we were doing, the PRP is often used for joints. You could do backs, you could do necks. It works best for mild to moderate arthritis or sprains, strains, tendinitis, tendinosis, and also slow healing wounds. Those are the things that we use it for most. There are some other applications, but most of what I do with it will probably be things like knees, everything from LCLs, ACLs, and mostly arthritis. So we'll go intra-articular into the joints and nearby to the tendons and the ligaments that are damaged, or muscles. Sometimes we will do them for back as well. I'm not doing ultrasound guided. For a lot of the joints, you don't need them. You can do it in a fluoroscopy. If you're going to get in all that, you're probably better off going for a full stem cell procedure and doing all that, because you're going to spend almost the same amount of money. So for the PRP, shoulders, knees, hips, and then if I'm doing back or spine stuff, it's going to be more intramuscular or subcutaneous, kind of close enough where we're going to let it sink in and kind of cover that whole area without getting too close to the spine where you're actually worried about like hitting a nerve or doing any damage or anything like that. But I've had extremely high success with it. We've done everything from, osteoarthritis and hips, knees. One of the other things we use it a lot for is lateral epicondylitis, right, or tennis elbow, right? So sometimes even plantar fasciitis. So, and the concept is some of these areas, specifically like tendons, right? Tendons don't have their own blood supply. So tendinitis or tennis elbow or golfer's elbow or one of these things, they're not getting blood flow anywhere. So it's going to be difficult for the tendon to heal. So if you sprain something right at the muscle tendon junction, or let's say intra-articular, right, inside of the knee capsule, there's not really blood flow and circulation in there. So as we're taking the PRP and we're re-injecting your own blood that's been concentrated in the platelets to that area, you're increasing circulation of that area. And as you increase circulation, that comes with the growth factors and the cytokines and T cells and B cells and all your things that are going to go in, and they're going to look for diseased and damaged tissue, and they're going to start to repair it, because that's what your body is designed to do. And sometimes it just needs a little boost to kind of help it. So if we can concentrate your platelets times 7 and then inject it directly to where you want it to heal, it's going to speed up your healing process, 10x, 100x kind of, it just depends, on a case-by-case basis. But we see incredible results with it. If somebody is a good candidate, and that's the key part, is making sure to get a proper diagnosis in the beginning and making sure you know what you're doing, rather than just, hey, well, do any procedure, give us your money, right? If they're a good candidate, we probably have 80% or higher successful results with it. I've seen miracles with, like I said, with shoulders, knees, and tendinitis, and even sciatica and some of the other issues.
That's awesome. It's really cool that you were explaining like the process amongst all of it, because I actually myself had just a surface level understanding. It's like they go in, centrifuge your blood and put it back in, but to be able to learn about the hormones and growth factors that are actually necessary to help your body repair itself. And I love the fact that you brought up this concept, or not concept, but this principle that it improves blood flow to areas of where there's not much blood flow to begin with. So musculotendinous junctions, areas that there isn't too much of what we call capillary density, right? Because if you're not having as much blood flow, then the opportunity to heal that area is not going to be as high. And listeners, you can see this kind of throughout your body, where you can have a cut or a scrape on, say, like the palm of your hand, and that'll heal way faster compared to having a cut or a scrape on a different area of our body that doesn't have as much of a blood or nerve supply. And so I really appreciate that, and especially because of the fact that there's so many possible side effects and adverse reactions when you're getting something like a steroid injection, or even something short-lived, like even just having an anesthetic applied to an area, right? And so here you are providing an environment for tissues to heal themselves, which I'm glad that you brought up that, you know, how it's great for joints, but also when we're looking from a sciatica standpoint. Now, listeners, again, if this isn't your first episode, remember, sciatica is just a diagnosis. It's a description of where your pain is coming from, or it's a description of your pain distribution. And what that means is it doesn't necessarily tell you, is the pain that you're experiencing, is it actually truly caused by a herniated, a bulging, or extruding disc? Could it be that you're having an issue with an arthritic facet? Could you have an issue with the foramen in which the nerve root is exiting out? And that is only the areas of the spine. The sciatic nerve itself is the longest nerve in the body, and it follows a very long path. So we have to be able to look at what's happening at the hip, what's happening at the knee, and what we're having to do. So, Dr. Fields, for someone who's been dealing with sciatica and they're like, oh, okay, well, I have some damaged tissues here and there. If they were to come in and speak with you and they're saying, okay, I'm having sciatic issues, I'm having a herniation here, here, and here, what are the typical things that you look for in order for you to determine, one, is this person a good candidate, but also two, what are the things that you look for that help you understand, okay, I should be injecting in this specific area versus another?
Great question. And going back to, you know, once again, I think proper diagnosis is the most important part. Sciatica, believe it or not, is one of the most misdiagnosed things that we see in the clinic, right? Because everybody comes in, I have back pain, I have sciatica, the doctor said it's sciatica. And they kind of throw that around like fibromyalgia or general anxiety. It's just one of these blanket terms that they're kind of using for any pain that may or may not be radiating down the leg or kind of affecting the glutes and the lower back. Same with the disc herniations, right? So, and you've probably familiar with these studies, but right, they've done studies. There's been a couple big studies, 1,000+ patients where they've done MRIs where, you know, let's say they have 1,000+ people that all had disc herniations and bulges, and half of them have zero pain. So the fact that you have a herniation or a bulge doesn't mean that's what your pain is going. It doesn't mean that it's not the cause of your pain, but often there's going to be other factors involved. And then how did that just get herniated in the first place? It's not always some kind of trauma or incident or lift that they did. So probably about a third of the cases I see that come in for sciatica and lower back pain are often misdiagnosed. And this is something you probably see a lot of, which will be, you know, a gluteal pain, right? With the glute medius or minimus. So one of the first things I'll do is do a Trendelenburg test on them, right? And if they get a positive result on that, I'm going to refer them to you, right? I'll treat it because I'll want to increase circulation of that area. I'll want to get out any knots in that. But what people don't understand is that the path of the gluteal pain, right? If you have a weak gluteus medius and minimus, which most people do because we just are so sedentary these days, we spend so much time at a desk or driving. Even you'd be surprised. I mean, even a lot of the athletes I see that come in or people that are extremely athletic, you know, they're training and they're doing deadlifts and squats and all these things, but they're not actually activating the muscles. And they come in and then they're jacked up and buff, but you know, you touch the glutes and they're quite like flaccid, right? So a lot of times I know right away. And then in that case, will PRP help? Yeah, tremendously. But they still need to see you. They still need to be with a physical therapist that knows what they're doing. Because if they go into any old PT and they're just running ultrasound and e-stim on them and telling them, here, ride the bike for 5 minutes, that will never, ever, ever get better. And usually these cases, I see they come in and they've already had a couple cortisone shots, right? Or they've been going to the chiropractor twice a week for 6 months, and the problem hasn't gotten any better, right? Because they're not actually addressing the root cause of the problem, and it's been misdiagnosed. But the point specifically with the gluteal pain is we call it pseudosciatica sometimes because it could actually run down the leg all the way down to your calf and sometimes even lower, same as sciatic pain would. So I think most doctors, just anytime they hear it's going down the leg, they're automatically jumping to sciatica. And they're not distinguishing, are you actually having any burning or numbness or tingling, which would be more indicative of a nerve being pinched or some kind of nerve problem, right? Then, so we can do PRP, and if that is the case, then you'd probably be a candidate. As far as location that you brought up, we would probably work on getting into the glutes, right? Probably I would do an injection or two at the origin of the muscle, right, on the back of the iliac crest over there, and then one closer to the hip, closer to the greater trochanter, right, in that area. So we could kind of cover and probably do a few trigger points along the way. That way we can kind of invigorate those muscles, and as they're working with you on the physical therapy and doing their exercises, they'll speed up the healing process tremendously. They might even get immediate relief from it, right? But I'm very honest with the patients. I tell them, look, in your case, if you don't do these exercises, this problem is never going away. It might be good for a week. It might be good for a month. It's going to come back, right? So that's one. Another one that we often see sciatica misdiagnosed from is, and you're familiar with this, is piriformis syndrome, right? Because the piriformis is one of these muscles that's underneath the glutes, and it runs right over, horizontally over the sciatic nerve bundle, which the sciatic nerve isn't really one nerve. It's a whole bundle of nerves, and I've been in cadaver class and have looked it up. And if you look at most of your nerves, they're about hair thin. But when you look at the sciatic nerve, it's actually a bundle. It's almost as thick as like an electrical cord. And that's why it can be so painful and excruciating and completely disable certain people, because there's so much signal that could be sent through that nerve, right? So if it's a piriformis syndrome, oftentimes the piriformis will just be too tight or have some muscular adhesions in it or some knots from sitting on it too much, or it just got too tight. And then a good place to do a PRP injection would be directly into that muscle. I would probably do it at the insertion point, at the origin point, and one into the muscle belly. I'd hit all three areas to kind of disperse into there, rather than just trying to do one singular injection. I've always found better results. And being trained initially as an acupuncturist, right, we would kind of, which is more of like an orthopedic acupuncture style / dry needling, which comes from orthopedic acupuncture, to work the whole muscle. Because being realistic, just throwing one injection in there, which is what a lot of doctors would do and a lot of orthopedics even do, it's not going to be as effective, because the puncture itself from the needle is going to be is basically like doing a trigger point injection or acupuncture. But then when you're adding the PRP material in there, the platelets and the fresh blood supply, that's going to help. So if you're getting the origin, the insertion, and the muscle belly, you're just going to have way better results, right? And then lastly, I think was what you mentioned, sometimes sciatic is a problem of a herniation or a facet joint. Sometimes nerves can be kind of trapped near the foramen, or SI inflammation, SI joint inflammation can cause, these problems. So I'll palpate a lot. I like it when patients bring in MRI results, right? I usually prefer the report of findings, not the disc. I'm not a radiologist, so it's I can interpret it, but it's best if you bring in a report, and then we can look over. If we know you have a herniation at L4 or L5 on what side it is, then we could kind of get closer to that area. I would put some there. And then what I often do when I'm treating it, whether it be PRP or acupuncture, I will actually trace the route of the nerve down the legs, right? So I might start off and put some PRP, and most orthopedics and doctors don't do this. And I think this is why I have better success in a lot of them. Like I said, I would get the different areas that might be involved. So I might start the injection right there near the disc, right? And kind of intramuscularly in that area, let it soak in. Maybe the QL is pulling your spine out of place. Maybe that's part of the problem. So maybe we need to do a quadratus lumborum release or something as well. And maybe that muscle's all knotted up and contributing to the issue. Or so, I might hit the SI, I might hit the glutes and the piriformis down the route, and then I might even trace it going down the leg. We might even hit somewhere in between the hamstrings, possibly the calf, or right under your the head of the fibula over there, because the common peroneal nerve runs there, and that's a branch of the sciatic nerve. And often the pain path will travel down there as well. So I might actually do a few points along that path. So you're getting multiple areas that are involved in the nerve. And then typically I will also, which is another thing that most doctors don't do, I will also work with the patients and discuss, some nutrition, hydration, minerals, nutrient supplements, or herbs that could also be effective and are kind of going to be catered to the person's constitution and their body type and what's going on. Because like we mentioned earlier, if you're not addressing the person's systemic issues, even PRP is unlikely to have a good result. Any treatment is unlikely to have a good result. Even the surgical outcomes are going to be lower if you have other systemic issues. And everybody's issues are different. They're not the same, which is why just saying, oh, you have sciatica, I'm going to inject your L4 or I'm going to inject your Perform. It doesn't work like that. It's just you're not going to get long-lasting results, and it's disingenuous, and it's taking the easy way out. And that's what allopathic conventional medicine does. They treat the symptoms. They're not treating the root cause.
I really appreciate that. I mean, you have a specific process in being able to determine what is the source of the cause of the issue. I really appreciate that thought process because that's how it should be done. Truth be told, everyone's pain is an individual experience. And so to say every person who's experiencing pain along the sciatic nerve distribution will benefit from an injection here is short-sighted, because there's so many opportunities for us to be able to help, because the nerve is long. It's long, and there are many areas in which it can get jammed up. And I love how you were talking about the use of PRP as improving the body's ability to heal. But also using like the needle itself will actually reduce some of those trigger points as well. So I really appreciate that. And it's important for people to understand that this is what should be going, like this process of what Dr. Fields was discussing. This is what should be going on in every person that you're coming to. It should be going in their head. They should be able to say, this might be the issue, but in order for us to know that, we have to run a couple different tests, and we need to get the necessary data to be able to say, with a high likelihood, I think this is the scenario. And ultimately, everything that we're doing as clinicians is starting off with an educated guess with the information we're provided. And then based off of your reactions, that will actually either support what we are suspecting or refute what we're suspecting. And it requires us to change direction. And here you have PRP, which is an opportunity to allow your body to heal, but there's a reason why that tissue got hurt in the first place. And so I like to think about people like Dr. Fields, anyone who, and other providers who are providing these interventions, even surgeons as well. They're the folks who actually help the body heal. But it's our jobs as physical therapists to make sure that you're using your body right, because you can use your body incorrectly, get an injection, feel great, and then go back to doing like the things that you used to do, going back to your bad habits. And that is only going to result in temporary results. But you get the improvement, you have the ability to move, you learn how to move correctly, changing your behaviors, whether it be movement or nutrition or lifestyle. And then you actually allow yourself to have a much more resilient body, which allows you to heal, feel happy, and awesome. Dr. Fields, let's talk about some of the recovery. I think I've heard from various different patients I've worked with. Some people, when they get PRP, they're like, I need to not do anything for 6 weeks. Some people are like, I got the PRP injection, I can go do cartwheels the next day. So what is the typical rebound time for after someone gets a PRP procedure done?
So you're totally right. It's all over the map what doctors are recommending. So here's the deal. One, again, it's going to depend on the injury or what happened, right? If you truly do have a severely herniated disc, it's going to be very different than somebody who's just got some, inflammation or piriformis syndrome or something else like that, right? But for the most part, ideally, the reason you're doing this is probably so you can get back to the activity that you like to do. And if you sit and baby it for too long, I find you're actually going to make the condition worse. And we often see this in cases of like a frozen shoulder, right? You get a little trauma on the shoulder and it's like, oh, I'm not going to do it. And then, whoops, I can't lift my arm anymore, right? And now it's a whole nother mess you created. So I usually have patients return to activity as soon as possible, usually the next day. Then you're going to take it a little easy, right? If we did your knee and you're going to have a little inflammation the first 24 to 48 hours, maybe 72 hours, you're going to be a little sore. So you're not going to want to go full on. You're not going to go back and try to max out any exercises or anything like that. But at the same time, we are talking about circulation. We are intentionally causing acute inflammation, which is different from the chronic inflammation that you had kind of got you into this condition. So you do want to move the blood. You do want to encourage circulation. And by doing exercise, like kind of some of the things you just mentioned, like it will increase, dopamine and just overall feelings of well-being, which will help you heal faster. So I am not a proponent of sitting still with it. You're not going to go straight from PRP to run a 5K, but you should do some walking the same day. You can do a light workout the next couple of days, and within a few days you should be back to full activities. Now, what we didn't talk about though is kind of the recovery process from the PRP, as far as what to expect is results, right? And it is a stem cell process. It's not like popping an aspirin. It's not like you do it or a steroid injection, we do it, or a lidocaine injection, we do it, and then you're numb and then you don't feel anything, right? It is going to cause some temporary acute inflammation, which is what is going to start, the process of the regeneration, which is going to happen over weeks and months to come. It can take up to 8 months to get the full results from a PRP, but usually you should start feeling better within 2 to 4 weeks. Now, I have had patients that had instant relief. I'm talking about next day. The last one I had was actually a woman in her early 70s with an arthritic hip, and I was not expecting to see quick results because generally at that age, right, and the hip, depending on the severity of the arthritis, that can be quite problematic. And I did a PRP injection for her probably about 2 months ago, and she had relief within a day or two, and she's been fine ever since. She didn't even need to come for follow-ups, right? So sometimes, depending on the severity of the problem, you might need to do 2 or 3 PRPs. And very often that's what athletes do. And sometimes they'll do them before surgery and after surgery, right? With surgery, most of us are doing them to avoid surgery or to buy us, an extra few years and things like that. So once again, it's a case-by-case basis, but you got to get the right diagnosis first. You got to have a provider that you trust. And if the doctors are not performing orthopedic exams on you, if they're not asking questions, if they're not interested in your lifestyle, I don't trust that they really have your best interests at heart. I've had patients come in. For example, I had a patient come in with a frozen shoulder, actually, and that was in so much pain. He had been in the ER twice in 1 week, okay? And they did an MRI of his neck, and he had herniated discs, and they told him he needed a spinal surgery that was going to put him out of commission for 6 months. He wouldn't be able to work and feed his family, okay? He came in. The doctor that told him he needed spinal surgery never performed an orthopedic exam on him. So the orthopedic doctor didn't bother to spend 2 minutes, orthopedic shoulder exam, right? It doesn't take more than 2 minutes, right? You could probably do it faster in some cases, right? So I ran the exam for him, and very quickly I said, okay, I'm not discounting that your neck is jacked up, but obviously your supraspinatus isn't firing, your infraspinatus is whack, right? Your rotator cuff is just not working. And just within a few acupuncture sessions, actually within 5 sessions, 100% pain relief, 100% range of motion back after a year. And not every case is that easy, but that's just one example of why people shouldn't be quick to jump to surgery, and why in the beginning we spoke about try different providers, get a second opinion, get a third opinion, get a 5th opinion if you need to. Like, keep looking until you find someone that you're comfortable with and that seems like they know what they're doing. And if it doesn't work, try a different method. Yeah,
this is huge. Being able to just continue to search. This brings me to my second to last question. I think, people are hearing this. They're like, okay, PRP can actually be a really beneficial tool. Mm-hmm. At what point in my healing journey, how many providers do I actually need to see? How many interventions do I need to actually get before I actually even have to consider something like this? Because regenerative medicine is, it's been around for a while, but it's really getting a huge rise. but there's still like people go and then they're talking to their providers. They're like, what do you think I should do? And they might not necessarily be the well-versed. So when it comes to the healing journey itself, what would you say is the best timing? Like, is it sooner rather than later? Like, try it before you get your cortisone injections, or tell us a little bit more about that.
That's a tricky question. And let's just be clear here that everything we're discussing is for educational purposes and entertainment purposes,
Absolutely.
Medical advice. And part of that is something people are going to have to determine for themselves. I am not a big fan of the cortisone injections for some of the side effects we mentioned earlier. However, I have seen patients that have been in extreme pain, and sometimes one works for them. Personally, if it was me, if I had tried one and it didn't work, I'm definitely not letting that same person do another one, right? Sometimes I see that, oh, he did two, and now he wants me to come back and do another one, and it doesn't sound promising to me, right? If I'm not a big fan of the NSAIDs or anti-inflammatories or Tylenol and that stuff either, because they have effects on your liver, there's gut health. There's over 7,000 Americans that die every year from Tylenol and aspirin, which most people don't know. And then there's hundreds of thousands more on them and cause gastric bleeding and acid reflux and all these things that are often not being put two and two together. So, but if I'm in severe pain personally, I might try it for 1 or 2 days, right? And then see if I get some relief for that. I will usually, depending on the severity of what's going on, I'm a big fan of chiropractic for short term. It's not a long-term fix. I'm a big fan of what you do. I work with, functional training, and I've been, just learning about that kind of stuff on my own for my own martial arts related injuries. And that, what you do has actually been the most beneficial for me, probably out of everything for the long term. So I would always say, try to find a good PT first. The problem is most of them are terrible. So I would have the patients contact you first so they could try to get a good diagnosis, at least an understanding of what the problem may be. I would see an orthopedic or two. Surgery, I think, should always be the very, very, very last option. I would never even consider it until you've tried everything else, right? No matter what they tell you, try everything else first. And depending on the severity of pain, obviously, if you ruptured a disc and you are paralyzed, then you might, be a candidate for immediate surgery or something like that. But if you're still walking, if you're still able to kind of get around, even if you're limping or whatever, I would try all these other things first. I would try acupuncture, chiropractic, physical therapy, massage, hot, cold therapy, the things that are going to be the least invasive first. And then I'd say, then you'd probably be a candidate for the PRP. All right. And I do have patients that sometimes they're just like, they come in and they're like, I've had tennis elbow for a while, or my shoulder hurts. I want PRP. And that's fine, as long as we check them to make sure it's not some kind of structural problem. Because if I believe it's a structural problem and I'm giving them PRP, that's also disingenuous, and that's like a money grab, which is, if you don't get results for patients, or if they find out down the road that you weren't honest with them, it ruins your reputation. And in the future, I also am a big believer in karma as well. So we just try to avoid those kinds of things. But it's going to be an individual decision, case by case basis.
100%. That makes total sense. And so, PRP, injections, surgery, they're all tools. They're all tools in the toolbox of health and pain management. Not everything is going to look like a nail, which means that we have to hammer it out. Right. It's really going to be based on what you're presenting with and what you need. So continue to be an advocate for yourself. Now, Dr. Fields, some of the listeners are probably thinking, man, I want to be able to converse with him. I know you're out in Florida. What's the best way for people to get in touch or learn a little bit more about how they can work with you?
Yeah, absolutely. Instagram or Facebook is easy to find me at Jonathan M. Fields. It's JONATHAN, M as Matthew, Fields. And they could look up either one of the clinics that I have. One is Create Health, which is just CR8 Health, the letter C, the letter R, the number 8, health.com, or at CR8 Health. And then Integrative Medicine US, which you see on the screen, is the other one. You can look that up. That website's integrativemedicine.us or at iMedicineUS. But Create Health is probably an easy one to find me at, just cr8health.com.
Awesome. Listeners, if you didn't get a chance to write that down, I'm actually going to be putting his contact information into the show notes for today. Dr. Fields, It was such a pleasure having you on today's episode.
I appreciate it, Doc. Thanks so much for having me. I thought it was a great discussion, very informational, and I enjoyed it a lot. Hope to be back in the future for maybe another topic.
Absolutely.
Keep doing what you're doing. We need more good PTs like you helping people avoid the unnecessary drugs and the surgeries. There's time and a place, and like I mentioned, I think what you do should be the first line of defense and preventative, not only for healing, but to prevent future injuries.
I can't agree with you more. Thank you so much.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.